The views, opinions, and content of the show are those of the host, guests, and callers. They do not necessarily reflect those of Local Matters Broadcasting, LLC, its owners, partners, affiliates, assigns, or heirs. Having said that, it's now time to say good morning, St. Johns County. Welcome to the weekly radio show of the St. Johns County Council on Aging, better known in our community as the COA. We are your local nonprofit agency who for the past 51 years has been leading and advocating for the dignity, independence, health, and community involvement of older St. Johns County residents. I'm Brian Robinson, Program Director for COA, broadcasting to you live from the studio of WFOY 102.1 FM, your local radio station for news, sports, and talk. Before we get into our show, let me remind everyone that if you have a question, comment, or a suggestion for a radio show topic, please send your email to radio@coasjc.org. Again, that's radio@coasjc.org. I do have my email up in front of me this morning, so if you have a question during the show, feel free to email that as well. We'll try to work it in. This morning, I'm joined by Dr. Bonnie Rogulj, who serves as an assistant professor of physical therapy programs at the University of St. Augustine for Health Sciences. Dr. Rogulj completed her undergraduate degree at the University of Virginia, graduating with honors, and her doctor of physical therapy at Old Dominion University. She is a licensed staff physical therapist in Florida and Virginia, has completed an accredited geriatric residency at Brooks Institute for Higher Learning, and is a board-certified geriatric specialist. Dr. Rogulj is currently completing a Doctor of Philosophy degree in Higher Education and Administration at Liberty University. Dr. Rogulj is a credential Falls and Balance professional and completed certifications in Stepping On, Steady, Otago, and Mental Health First Aid. She is interested in community service related to the geriatric population and research in aging, health, wellness, and higher education. Welcome to the show.
Thank you so much, Brian. Good morning to all our listeners as well.
Well, and I was wanting to make sure I pronounced your last name correctly. So did I get it right?
Yes, it was great. I get that a lot.
Fantastic. Well, great. Thank you so much for taking time out of your very busy schedule to come on the show with us. But before we get into questions, one of the things that I wanted to talk about is the University of St. Augustine for Health Sciences. It has been a part of our community for over 25 years. It is relocating to a new location, the former St. Augustine Record Building. I'm just wondering, have you got settled into the new location?
Yes, we have. Actually, this past weekend was my very first weekend at the new building, at the new beautiful site. And so, as you know, when you are coming off of the highway and you get to the intersection with 207 and 312, the record building is really the prominent building right there. Mm-hmm. And so having this be our new campus, our One News Place location, this has been something that is maintaining history here in St. Augustine. It's also promoting growth and having more students come to our campus site and just really giving us a new vision to continue to help our community and help in our professions, and so of health sciences. So it was very exciting being able to go to the new site and actually teach in the labs this past weekend, and seeing the students on the campus just enjoying themselves. They were sitting under the umbrellas. It was a beautiful day. They were able to access the lounge and the study areas. And so just being able to walk through the building, I was just taking it all in. Mm-hmm. And so I'm looking forward to this upcoming weekend. It'll be my second lab weekend on their new site. And being one of the faculty members that really likes to use the different innovation center and the library, just being able to see this new space and how they're utilizing it and being innovative and having new equipment that's coming in for our students to use, it's exciting. And so seeing this growth, I've been at the university for about 7 years. This will be going into my 8th. And so just watching it grow and being a part of that, it's really special.
Well, I've had the opportunity as program director at Council on Aging, coming up on 3 years in July that I've been there, but I've had the opportunity to interact with your students. They come to our senior center and also to our adult daycare center and do different things with the seniors, and just a fine group of young people, and I can say that because I'm in my 50s, right? A fine group of young people that are there, that are students at your university. And so I just want to commend you and all the other staff, the great job that you're doing with those students. And we just love having them come. And I'm so glad that you come and volunteer and which benefits our seniors?
The students are so grateful. They love to be able to go to the Council on Aging and engage with the members there in our community and give back. And really that engagement and that interaction is the best way to learn as well. And so as I've been a course instructor in the geriatric physical therapy course for the Flex hybrid program at the university, and the students, they had a portfolio that they worked on where they went to the Council on Aging and they did different projects and assignments. They volunteered their time and attended classes or performed interviews. And just time and time again, as I would read this global reflection paper assignment that the students would submit for their portfolio, that was the key takeaway. Being able to meet a new friend, being able to listen and engage and learn from them, being able to be involved in, a Tai Chi class or chair yoga or going and doing a dance, observing a ballroom dance class. And so that was so special and such a great way for them to learn from the seniors that are in our community and be able to really, think about that passion and how they might want to work with that population. They may, after they finish school, might want to be a part of the Council on Aging and being in our community. And so I think that service and just being able to really meet people and connect with people is what it's all about.
Well, we're very thankful for the partnership that we've had over the years and that we'll continue to have in the years to come. And I'm just excited for your new location. I think it looks great. I mean, I haven't been able to been there yet and tour it, but just phenomenal. I'm so excited for all of you and all of the students and all of the future students that will come and visit and just get to partake in a new location with all of the state-of-the-art stuff that you have available for them to learn. So that's very exciting. All right, well, we're going to go ahead. We're going to take our first break right now. And you're listening to the weekly radio show, the St. Johns County Council on Aging. We'll be right back after these messages. And welcome back to the weekly radio show, the St. Johns County Council on Aging, here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for Council on Aging. Joined this morning by Dr. Bonnie Rogulj, Assistant Professor of Physical Therapy Programs at the University of St. Augustine for Health Sciences. And in our first segment, we were talking about the new building and how exciting that is and about the partnership that our two organizations have together, and we're so thankful for that. What I wanted to do now is one of the things that I like to do is let our listeners get to know you a little bit personally. And so I've already gave your bio as far as your credentials go. I would love if you would just talk a little bit about your personal story as to why you pursued your career and especially your reason for becoming a board-certified geriatric specialist.
Yes, great question. I think about just my past and how it led to where I am today, and there's really two significant things that stand out to me. The first one being in my younger years, I was a swimmer, and so I used to compete and ended up being a collegiate swimmer. But when I was in high school, middle school time frame, I had an injury to my shoulder, and so it was an overuse injury to the rotator cuff, and so the muscles that stabilize my shoulder. And swimming, repeated lap after lap, and just really overuse injuries developing commonly in that sport, that was something that I experienced. And it came at a time where I was preparing for a high-level competition, and so there were state meets coming up and national meets coming up, and I wanted to perform at my best. And so I actually sought out a physical therapy session, and that was locally in Virginia where I grew up. And going to the physical therapist and having this physical therapist talk to me about my dreams and my goals at a young age, it really made an impression on me. And I was able to do just some exercises that were simple. I could do them at home, and they strengthened my rotator cuff around my shoulder, and then I was able to get back in the water and complete what I had started and prepare for that big competition. And it led to a lot of other wonderful things in my life. So being able to swim competitively and develop those relationships. So that was really the first significant factor that led for me to consider physical therapy at a young age. But then even more so, growing up, my mom's father, who we lovingly called Pawpaw, he lived very close to us. And as he was aging, he went through some complications with his health and his medical history. And one of the things that my Pawpaw loved was going to the ocean with us. And so every year we would go go to North Carolina in the Outer Banks. We still do that as a family. And he was coming with us, but we didn't realize at the time that he was experiencing more changes than I think what we were aware of, especially me being so young and not having any medical background at that time. And Pawpaw went down into the water, but he was not steady. And so stepping in the sand and having the waves come up, he lost his balance and slipped from my mom's grip, who was beside him in the water. And he took a tumble. And that was the initial fall. And so after that fall occurred, watching my Pawpaw and how he kind of chuckled and brushed it off, but that I saw that he actually became a little bit fearful of getting back into the water and just more cautious. And then for the years to come, he didn't want to go to the beach with us, even though he loved the water. Well, Pawpaw ended up having some additional health complications, and he experienced several other falls. And so being young and observing how this affects quality of life and being able to have that takeaway that Pawpaw's not doing the things that he likes because he doesn't want to fall. I really observed this, and it was something that made a big impression on my life. And so as I began to learn about physical therapy, and I applied to become a physical therapist and got into a physical therapy program, I really found that my passion was for fall prevention and also older adults. I think my mom, she really, was involved in the community growing up. She would bring me and have food delivery and different things that we did with our church. And so being around that and just being comfortable with seniors and doing things like that in my community, it really became this total, all the pieces of the puzzle. It became a complete picture for me that physical therapy would provide me the avenue and the opportunity to continue to do what I like to do. And so helping others, being able to help others achieve their goals and dreams like I did for my swimming, and then making a difference in the lives of seniors who might be at an increased risk of falling, just like my Pawpaw was, so that they can continue to do the things that they love. I had a friend named Brittany who was in my program at Old Dominion University, and she knew how much I liked working with the seniors and that I was interested in balance. And she said, "Bonnie, do you know that there is such thing as a geriatric residency?" And so I was a second-year physical therapy student, and I started to research and learn about residency programs and ultimately applied when I finished my program. And I moved from Virginia to Jacksonville for that reason. And so coming to Jacksonville, Florida, I was able to participate in an accredited residency at Brooks Institute of Higher Learning. And so all of those pieces started to come together. Mm-hmm. And so doing that residency was a really wonderful experience, and I highly recommend it. It opened a lot of doors for me, and I gained so much knowledge and skills from doing that one-year residency.
Mm-hmm. And I want to go back to something you said, the importance of fall prevention. Because really, a lot of times, especially when you're older, if you have a fall, then sometimes that just kind of starts the downhill path, right? And that I saw that happen with my mom. She was, I'm originally from West Virginia, and my mom was, that's where she grew up and lived all her life. But it was like September of 2022. She was out on our back patio, didn't realize that there was a rolled up carpet behind her. She had forgotten it was there. And she tripped and fell and broke her hip. And then that was it. It was just downhill from there. And she passed away May of last year. But just looking back, she up to that point, she was very active. I mean, she still drove. She still took care of her yard. She was very active in her church and just went everywhere, right? But after that fall, it just seemed like she never fully recovered from it. And then it was just kind of one thing after another, downhill from there, basically. And so fall prevention is very important. So I'm glad that you brought that up. And I think we'll be talking about that a little bit more as we go on. But also, I love the fact of how swimming, played an important part in your life, because both of my kids were swimmers at young ages. But my oldest, she then became a lifeguard, and then that's what she worked as at the YMCA to help put herself through Ohio State University when she was going there as a college student. And so it's just fun to hear that. And four of my cousins were all swimmers. They all went to college with scholarships. Two of them swam for West Virginia University. One swam for Pitt, and then the other for Michigan State University. So just fun to hear that. Yeah, it's just fun to hear you talk about that. So thank you for sharing your personal story. And so we might get interrupted by a commercial break as we dive into this next question, and but that's okay. We'll just pick up where we left off if that happens. But today's topic is physical therapy, and so I was wondering if you would tell our listeners the difference between physical therapy and occupational therapy, because we do hear those terms used, and sometimes I think folks get confused about the two. So tell us the difference of those, but also do they ever overlap when you're working toward a specific outcome, such as attaining good balance for somebody?
Yes. So I get asked this a lot, and there is overlap. There's a lot of times when you're working with a patient or a client, and they'll say, I just had physical therapy. I'm now having occupational therapy, or vice versa. What is the difference? And then at times we even co-treat together. And so being able to recognize that we have an examination, a diagnosis, a treatment process for individuals, and that we work side by side and collaborate together, you can see how sometimes it gets a little gray area. And so one thing that I brought with me today was actually a flyer, because we, as the American Physical Therapy profession and a member of the APTA, want to recommend an annual visit for individuals so that they are going consistently and being screened for health conditions. This flyer that is available online on the APTA, AmericanPhysicalTherapy.org website, it gives a definition of a physical therapist. And so if I may, I'd like to read this.
Absolutely.
Physical therapists are licensed doctors who examine, diagnose, and treat movement dysfunction. Physical therapists work with multiple patient populations and people impacted by disease, injury, disability, and movement dysfunction. They optimize quality of life by maintaining, restoring, and improving their patients' ability to move and perform functional activities. And so as I think about physical therapists and their role in this interdisciplinary team, they're really the movement specialists. And so understanding the different systems of the body and that contribute to movement and helping to restore movement, maintain movement, maximize movement to promote health and wellness among different individuals. And occupational therapy, the American Occupational Therapy Association, they also have a lot of resources. And the resource that I found to be interesting, what is occupational therapy? It's a brochure that's available, and so anyone can go to their website and check it out. And it just talks about occupations, these meaningful everyday activities. And so for me, my occupations are being a spouse, being a parent, being a teacher, being a master swimmer, being someone who works out and be able to do the things that I enjoy, drawing, cooking. And so all of these are occupations. And so if you are someone who's recovering from an accident or an injury and you are valuing these occupations in your life, then that is what occupational therapy is going to specialize in, being able to maintain those occupations, those various roles, to really allow for you to do the things in your daily life that are meaningful to you. And so again, two valued members that collaborate together, that because we are examining, diagnosing, trying to give interventions, there's going to be overlap at times, but really we work our best in our specific disciplines, and then we collaborate together and work together for the benefit of our patients and clients.
Mm-hmm. And so sometimes somebody might be referred to both occupational and physical therapists. So that music means it's time for our next break. So we'll continue on here in just a moment after these messages. And welcome back to the weekly radio show, the St. Johns County Council on Aging, here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined this morning by Dr. Bonnie Rogulj, the Assistant Professor of Physical Therapy Programs at the University of St. Augustine for Health Sciences. And prior to our commercial break, we were talking about the differences between physical therapy and occupational therapy. And so what I wanted to do now is just kind of shift to somebody out there that might be listening. They're an adult, they're age 60 or older. That's the demographic that we serve at Council on Aging. Let's say that they are referred to a physical therapist, right? And so what should this person expect to experience during the evaluation process? First question. Second part of the question, how long does physical therapy typically take? And the third part of that question is it best to complete your physical therapy even if you're feeling better? So I was wondering if you could kind of tackle those questions for us.
Yes. So as I think about the different questions, I think so much about how we have an individual that's going to have differences. Just the two of us, we have things in common, but there's so many differences. And so as a patient is coming or a client is coming to a physical therapist for an initial evaluation, they're going to come in. Maybe there's been two patients coming in on the same day that has had a recent surgery, or in our case, we've been talking about falls. And so let's take the scenario of a fall. So two patients that are sitting waiting for their initial evaluation that have both experienced a fall. Well, what if one person experienced a fall because perhaps they didn't have normal sensation in their body? They've had changes in their body that's led to them not being able to feel. And so their balance has been affected for that reason. And maybe that has caused for them to experience a fall on uneven surfaces. Where perhaps there's another who they're walking in their home and there's clutter in the environment and they have some weakness. And so being able to step over or be able to regain their balance if they become unsteady, that weakness has contributed to a fall. And so these differences, even though they're coming in for the same reason, ultimately there's been an incident that led for this to come and arrive for their initial evaluation. There's so many differences. And so as physical therapists, we go through screening and the process of screening and being able to look for anything that's going to really raise our awareness for the need to examine and assess further. And so being able to do a screening of vitals, for example, and looking to see, is there anything abnormal in blood pressure, anything abnormal in feeling for a pulse and seeing if that falls into a normal range. And then moving on from there into the different systems of the body, for example, the musculoskeletal system. If I'm doing a gross motor screen and I'm able to find that there's weakness that exists, or maybe there's something that has changed that's standing out to me. And so that's something that I would then, for example, there could be, a lack of range of motion. So being able to move normally and efficiently and effectively to be safe and have that, overall higher quality of life and independence, I can then assess that further. And so coming in and thinking about the individual variances that exist and the need to be able to screen and then assess further of that and then develop interventions, we can tie in evidence and look at evidence and make these decisions based on evidence in our practice for how long someone should participate in physical therapy. And so, for example, with falls, evidence shows that really we need to have a minimum amount of time, about 50 hours, that we're effectively working with someone to reduce fall risk. And not getting that amount of time, not meeting that minimum recommendation, can put someone at risk of not being ready to, effectively say that they're at a reduced risk of falling. There might have been some changes, but have they really made what evidence shows to be a meaningful difference in their overall presentation when it comes to fall risk? And so there is evidence to guide us, but there will come things that are really individualized. And so it won't be that cookie cutter. Mm-hmm. And there's been times that I've worked with patients that, they are seeking physical therapy for one thing, and then we find other things. And so being able to continue in therapy to address what they need to and really prioritize. Like right now, we need to work on building strength and having some protective balance techniques. But then maybe we also need to look at this deficit that you have in your range of motion that we can continue to work through as well. And so sometimes they come in with one thing and we realize there's actually multiple contributing factors that need to be addressed. Mm-hmm. And so again, being more individualized and looking at evidence to help us to be able to give that effective plan of care and the interventions that are going to maximize and really make the biggest difference. And when it comes to patients and clients who they're living their best life. You ask them, am I successfully aging? Am I doing the things that I want? Yes. Well, that is where the annual visit from the APTA and that recommendation that I discussed earlier, that comes in to maintain that, to be able to screen and prevent things early if we find that. And so having an annual visit with your provider that you come in and you can go through that screening process, they can help to be able to maintain that high level of function and that successful aging that everybody desires.
And then so back to my last part of that question, somebody starts feeling better or like, oh, I don't need this anymore. So what do you do in that point?
Well, I've had a lot of times that patients, clients, they may may think that I have improved so much, but they may not realize that there might be several goals that we established from day one that they're not fully met, but they're able to meet. And so I try to, really have that educational piece to say, okay, this is what we've done so far. There's been a lot of progress, because as soon as you start feeling better, I think about some of my family members that I had talked with you earlier. As soon as my dad is feeling better, he's ready to go and jump and get the fishing poles, get in the truck and drive to the river. And so, yes, we want you to do all those things that you enjoy, but maybe there's a few other goals that we're still working on so that you're going to be at the, best level that you can when you're fully discharged. And so that educational piece, because sometimes in our mind that I've made so much progress versus I have been able to achieve the highest level that I can right now in the time frame that I needed to. And so that educational piece becomes very important. Yeah,
and along those lines, and it makes me think of another question that I didn't really think of before our time together. What about as far as insurance limits sometimes the number of times you can go to a physical therapist, right? And so I think that probably sometimes hinders somebody's progress. And so is there a time when you say, okay, these are things that you should continue to do at home?
Yes. I think advocating for the patient's needs, working with the insurance, understanding what is available to that patient, and then also seeking out other resources. And as a physical therapist, there's also the home exercise component. And so in addition to the 2-3 times, sometimes 1 time a week that I might see a patient and client, I also want them to know these are the resources that are available in our community, like at the Council on Aging, showing them the calendar of events, looking and seeing if there's going to be some of these sessions that would really continue to maximize their health and wellness. And a good example is Tai Chi. And so maybe there's someone who's working on balance, participating in a Tai Chi class or getting the education in one of the classes such as a matter of balance. That could be extremely beneficial to their progress. And also creating that individualized home exercise program. So when you're not here are a few exercises, maybe 3 to 5 exercises that you can do safely in your environment that's going to allow for you to, to be able to achieve your goals.
All right, that music means it's time for our next commercial break. We'll be right back after these messages. And when you hear the Ramones, you know you are listening to the weekly radio show of the St. Johns County Council on Aging here on WFOY 102.1 FM. Your local radio station for news, sports, and talk. I'm Brian Routson, Program Director for COA, joined this morning by Dr. Bonnie Rogulj, the Assistant Professor of Physical Therapy Programs at the University of St. Augustine for Health Sciences. And we've been having a wonderful conversation about physical therapy. And I want to move on. I got a couple other questions that we may or may not get to in our last 10 minutes here. So my next question is this. As a credentialed balance and falls professional, what are some of the tips you provide seniors to help them avoid falling?
So this question is fully loaded because as we go back and we're thinking about the previous question and why someone would come to physical therapy and talking about those individual differences that exist, this also applies to fall prevention. And so as we think about these different factors that can contribute to falls, I think of it almost like a puzzle and the different pieces to the puzzle. The extrinsic factors, so for example, having a rug that you're tripping over, having footwear that's not safe that you're putting on your feet. Those extrinsic factors versus an intrinsic factor of age. Just being at an older age can place you at an increased risk of falling. These different factors come together. And so being able to, as a physical therapist, understand that it's not just a fall that occurred accidentally, I just tripped over myself, it's really nothing. I have to understand that there might have been different factors contributing to this, and so that screening process becomes very important to identify. And so my first helpful tip is going to be to go in and have that actual screening performed. And so the annual visit that the APTA promotes allows for individuals to go to a physical therapist and be screened and be able to recognize, are they at an increased risk of falling? And there are several factors that we know from evidence that, age alone, being age 65 and older, can place you at that increased risk of falling. And so age-related changes, having a change in your ability to walk, feeling unsteady, and then having a previous fall. all of those in itself will put you at an increased risk. And so number one to me is going to your provider and being able to get screened for falls and seeing if you're at a higher risk of falling. And then assessing further and identifying a plan to address those risk factors that you're able to modify. And so from there, also, different things that can contribute to falls that we need to consider. And this at times will fall into the scope of physical therapy when it comes to screening, but a lot of times I'll find myself referring and using those interprofessional relationships that I've developed with other healthcare providers. So one is medication. A lot of our patients and clients that come in are taking multiple medications that interact and have side effects. And so being able to have a pharmacist, for example, go through and look at those medications and really help with identifying ones that might be contributing to fall risk. There's a term that we use that's called polypharmacy, and it really just is a fancy way of saying multiple medications. And the more medications that someone is taking, the higher the risk for the interactions and those effects that might contribute to a fall. And so being able to screen medications and refer to a pharmacist is needed. And then also keeping your home safe. And so thinking about ways that in the environment that you spend the most time in, that you're, moving and functioning in and doing those things that you enjoy, how to keep that safe. And so that might require for a physical therapist and occupational therapist to come in and do a home assessment and be able to recognize things that could be a trip hazard. Maybe there needs to be increased lighting. Maybe there needs to be some modification. A lot of bathrooms that I'll go in, getting in and out of the bathtub, that can be a challenge. And so something as simple as a shower bench or a grab bar that's installed correctly, maybe a railing to be able to provide some additional support to get into the entryway, an extra lighting that's in that dark hallway, rolling up and moving out of the way that hazard of trip rugs. At my house, I have 3 dogs, and so a lot of times the trip hazards for me are dog toys, and so having a set area that I can keep those in. It's hard with a 3-year-old and the 3 dogs, but I try.
I'm sure that is very challenging, absolutely.
And so really, having that annual screen, having the different providers for referrals for medication, home safety, and then recognizing as well different changes that might have occurred. Maybe there's been a change in memory. You might find yourself having, to write things down, feeling more frustrated, thinking, oh, this is just a normal part of aging, but perhaps it's not. And so getting that screened. Changes in vision. A lot of times I'll hear, I've had these glasses for a long time, but I'm still having a hard time seeing, especially at night, or I've noticed some changes. And so a vision screen. And also changes in our balance and our strength. Getting out of the chair is getting a little more difficult. I got to use my hands a little bit more. I'm feeling a little wobbly. I enjoy doing this, but I'm feeling a little bit off balance, and so I'm having to hold on. Maybe I'm, using some external assistive devices. And so those changes that can be screened for, and then having the healthcare team, this interdisciplinary team to help manage that annual visit can be very helpful for those reasons.
That's great. Now, I was thinking as you were talking about that also, like, the importance of taking your time getting up from a chair so that you don't get lightheaded, right? I think that's another thing that we tend to forget about as well, for our elderly, that tends to happen. If they get up too quick, then they, might get lightheaded, and then that causes them to, lose their balance and fall. So that's another thing I was thinking about as you're talking about that. All right, the last thing I'd like you to share, we got a few more minutes left. You have a health and wellness screening to promote cardiovascular health that's coming up. I was wondering if you would share about that.
Yes. So at the University of St. Augustine for Health Sciences, we really enjoy that community collaboration and community service. And so being able to have members of our interdisciplinary team, the PT, OT, nursing, come together and with our faculty, our staff, and our students, give back to the community. We started with different events, and so one event in particular is in the fall. September is actually the recognized National Falls Prevention Awareness Week. And so we've started to do just community screenings for falls, and this led to a desire to continue that community engagement and service. And so this spring, we're doing an event outside of our fall event that is called Spring Into a Healthier You. And it was going to encompass a lot of our just national as well as global events that currently exist, that as a healthcare provider, I didn't even know all of the different events that really existed. And so I'm just going to read a few. As I was looking on the internet and learning about what is occurring in the spring that relates to health and wellness, some of these you may be familiar with and others not so much, just like I found I was. And so February, American Heart Month. We also have World Cancer Day in February. In March, we have National Nutrition Month, Save Your Vision Month, National Sleep Awareness Week. We have American Diabetes Alert Day, Patient Safety Awareness Week. And then as we continue to go down into the month of April, Stress Awareness Month, Occupational Therapy Month, National Interprofessional Healthcare Month, being able to recognize World Health Day that occurs in April, National Public Health Week. And then in May, we have Arthritis Awareness, Better Hearing and Speech, National Mental Health Awareness Month, National High Blood Pressure Awareness Month, Nurses Month, Stroke Awareness, National Women's Health, Skin Cancer Prevention, National Physical Fitness and Sports, and there's many more that I'm not reading through. And so, as you can see, health and wellness during the spring months and coming into the new part of the year, this fresh part of the year when we're wanting to get out, the cold weather is subsiding and we're ready to go.
And we get to turn the clocks ahead so we have more daylight.
Springing into it. And so this gives us an opportunity to really celebrate and also raise awareness and advocate for health and wellness. And so our event is going to have 10 different stations that anyone is welcome to come. It's free for all ages, but we're really wanting just to serve in our community. And so providing some basic health screenings related to fitness, related to vital screening, talking about stress management and getting adequate sleep, the role of nutrition and how that plays into our health, and just having our students and faculty volunteer. And so being able to really work together and collaborate and give back. And so this event that we're doing is going to be on Saturday, April 12th, and we're partnering with Melanie Lamaglio at the Rebloom Center. And so this is her own center, the Rebloom Center, that is actually a newer site. They've expanded, and so it's going to be very close to our campus location at One News Place. And so it allows for our students to get out in the community and be able to offer those free screenings and education.
Okay, and so anybody can come. Doesn't matter the
Anyone.
age. It's not
Please
just for
come.
seniors. So
Yes.
folks can come. They don't have to register or anything like that?
There's a registration form that you can do right when you arrive at the welcome check-in.
Okay. And it's April 12th. What were the hours again?
And it's going to be from 8 a.m. till 12 p.m.
Okay, and it's at Rebloom.
The Rebloom Center.
Okay. Do you know the actual address for that?
I will provide that to you.
Okay.
It's right across the street from our news site, and so One News Place.
Okay, so very close. All right. Well, we are getting close to the end of our show here, and I just want to let you know that next week we have St. Johns County Commissioner Ann Taylor will be in the studio, so tune in next week, same place, same time right here, WFOY 102.10 FM. Dr. Bonnie Rogulj, thank you for being with us this morning.
Thank
Everybody
you so
have
much.
a great rest of your day. We'll see you here next week.